Hi, I'm Dr Rupert Suckling. I'm the Director of Public Health here in Doncaster. As you know, we're now in day 2 of the new national restrictions, and this has a number of implications for all of us. We should stay at home as much as possible and only leave for specific reasons, including education, work and essential shopping. Schools, universities and colleges can remain open. Outdoor activity is allowed. You can meet one person from outside your household. Pubs and restaurants are now closed except for takeaways, and non-essential shops, leisure and entertainment venues are also closed. There should be no household mixing indoors or in private gardens unless you are part of a support or care bubble. I realise that these restrictions will be very challenging for us all over the next 4 weeks, but we must try and do all we can to keep our infection rate as low as possible. The current infection rate for Doncaster for the 7 days, the 24th to the 30th of October, is 531.9 per 100,000 people. This is one of the highest in England and in Yorkshire and Humber. This is not good news, but there is some evidence that this rate may be starting to flatten and we may be starting to turn the curve. So I want to thank you for all the efforts that you've made to support us and to help that rate flatten. But I do want to ask us all to keep doing what we're doing, keep maintaining our distance, keep washing our hands and wearing face coverings to see how quickly we can bring that number down. If we can all remember face, space and hands, we will have a better chance of leaving the national restrictions as quickly as possible. I'm also going to write to everyone in the borough who's clinically extremely vulnerable and offering them advice about how they can protect themselves during the winter months. And I'll be also writing to local businesses, care homes, schools and the voluntary community and faith sector to offer reminders to them about the restrictions. The advice, as always, remains if you have symptoms, a new persistent cough, a high temperature or a loss of or change to your sense of smell or taste, that you should self-isolate and organise to get a test. You are allowed to leave your house for the purposes of getting a test as long as you return straight away. Together, I'm sure we can do what we need to bring down the infection rate. So let's do it for Doncaster. Thank you.